In today's video, I'll be talking about the goods and the bads of both building your own dental practice versus franchising with someone who's already done it. I'll make sure that we're super objective, so let's get into it. But first, hi, I'm Dr. David Park, and I help multiple dental associate docs become owner dentists by building dental offices for them and not only build it, but help them succeed by giving them full support. This is what we do at Clear Lakes Dental. When thinking about profit, we have to think about a certain time period. So let's call it 5 years. When you're creating a dental clinic, you're still on the learning curve. So let's ask Google when most dental practices obtain the max revenue. Google states, on average, new practices take about 18 to 36 months to reach consistent profitability, with full maturity and maximum revenue often achieved within 4 to 7 years. While some startups may reach high revenue numbers sooner with strategic marketing, the standard timeline for building a stable, high-value patient base requires several years of growth. So, Google states 4 to 7 years. So, we'll go with 5 years. So, in scenario 1, with building your own dental practice, we're looking at 5 years until you hit your max revenue. And now we have the franchise. Since the franchise already has systems in place to schedule your patients on day 1, you have a head start. Most of our dental clinics hit max revenue in 1 year. So that means already you hit the ground running. So, for example, let's start here. We have ABC Dental. And then we have the chart here, and let's do max revenue here. We have 0 years to 5 years. And then we have CLD franchise. Cool. And we also have the max here, and we have 0 and 5. So if you look here, you can see that ABC Dental is slowly making its way up to max revenue on year 5. Whereas the CLD franchise, it kind of like goes all the way to the max revenue of 1 year, and then the rest just like that. Now, this is hypothetical situation because every situation is different. But, this is pretty much consistent for the average of what we got. But also, that's not all, guys. I'm going to show you something really cool. This is where it really gets interesting. So, if you look on the left over here, underneath this line, we're going to shade this color in green. And, whoa, that's pretty cool. Is this a crayon function? All right. And then we're going to shade it the other side in green as well. Yes. Oh, this is pretty cool. Okay, so now this highlight in green indicates the amount of money that ABC Dental and CLDF has made in the past 5 years. And this is critical because the amount of money that ABC Dental made versus CLD franchise made is worlds apart. So this is why it's super important to understand that time is money, quite literally. So CLD franchise wins on this one. Okay, so now let's talk about autonomy. After all, you're a dentist wanting to do your own thing, right? If you want to do cartwheels every time you finish a crown or dance when a patient pays you for a bridge, you certainly can. It's your clinic. Well, that's certainly valid at ABC Dental. Your dental clinic, your rules. That means you get to choose how you do dentistry and the dental business. Now we go into the franchise. Okay, so I have to be very clear. Even in the franchise world, there are many shades of colors or styles or whatever. Let me explain. For example, a lot of the current franchises have extremely restrictive control, like which labs to use, which equipments to get, which burrs to use, and how you sell dentistry to the patients, and even some controlling your treatment plans. Those are no good. They're there to make a patient's life miserable, your life miserable, all while making profits for themselves. But we don't do that. At Clear Lakes Dental Franchise, you pretty much choose everything. You want a CBCT? Cool. You want certain burrs or handpieces? Awesome. You want to choose the lab and how you do dentistry? Go for it. So what is the difference between the CLD franchise and other dental franchises? We provide maximum autonomy and let the owner dentist do what they want to do. If we do that, then we may be able to identify new technique or new code or even new equipment that will make all of our other dental clinics do better. That is our network effect. But let's get back to the point. From what I see in terms of autonomy, I think, let's write autonomy. And we have 2 signs here. Okay, so firstly, I think XYZ franchise is less than CLD franchise. And then it goes to ABC Dental Clinic. So in the end, I think ABC Dental gets the green check mark. Congrats! When a dentist builds a new dental clinic, it will take years for a new dental clinic to build up its system. So, pro tip, if you do build a system, make sure it's system dependent and not individual dependent. There's a huge difference to that. So pretty much if you make a dental practice based on a certain individual and not via the system, then you don't have a business, you have a job. An example is when you leave for a family vacation. So scenario 1, your team runs around like screaming chickens and the place burns down. Why? Because they're missing the shot collar. Scenario 2, your team is good because you have protocols in place that's specifically tailored to run while you are gone. It's imperative that you create a system and not a job. As for franchises, the systems are already established. It's a system that's been iterated again and again, offering less and less room for error. And less room for error means consistency. An example of this would be someone on your team that calls out for an emergency, or if you run into a dental supply issue, or anything else that can happen to your clinic. Your systems are in place and it will get you through the day without people screaming in stress. So in this case, the franchise wins. Now let's talk about having your own dedicated team. Again, same thing here. It'll take a long time to hire a team. Sometimes you'll have to go through many team members until you find your A team. Why is this the case? It just is. But can you do it faster? Well, the answer to that is pretty much having a good interview screening system. But guys, this is not what I'm talking about when it comes to team. You may have been thinking the clinical team, but I'm talking about your growth team. Because you're trying to grow and you will need to hire these types of people. So what kind of type of people? Well, let me tell you. The main ones I could think of are marketing department, social media department, recruiting department, call center department, and your billing department. That's just the bare minimum. But you see, a dental practice usually cannot afford to pay all these extra individuals that will help grow your clinic. And that's why in most dental clinic, growth is stagnant. But wait, there's more. Not to toot my own horn here, but at Clear Lake's Dental Franchise, we also have other departments that support our dental franchisees. They are the products department, AI tech department, internal auditing department, systems department, innovations department, and even the fulfillment department. And this is our specialty. We support all of our franchisees to make sure that they succeed while doing dentistry. After all, that's our job and that's what we do best. So in my mind, Clear Lake's Dental Franchise is clearly the winner here. In the end, I'm gonna go with the franchise model most definitely. Because we really have to break this down. Since the systems are better in a franchise, you have a dedicated team that's able to help you when you're needing administrative support and be able to have a work-life balance. That's a win for me. Now that you know about the why a franchise is usually better than building your own dental clinic, we should go over the financials for a franchise dental clinic. Check out this video here to learn about how much money you can make as a dental franchisee.
Ahui ho!